we also have our research department, which is making sure we know what's going on, and we have a pulse on what are the things that are most immediately affecting Black girls and women. So I'm Angela Grayson, the Advocacy and Outreach Coordinator for the Lighthouse Black Girls Project, and the lead organizer with the Black Women Vote Coalition, which is the organizing arm of the Lighthouse. The Lighthouse Black Girl Project is a nonprofit based here in Jackson, Mississippi. However, we have satellite offices across the United States in Ohio, Chicago, North Carolina, and also Georgia and Texas. We center Black girl and womanhood. So we have programming that does a number of things and it all centers Black girls and Black women. So we have programming that mentors college-age young ladies with leadership development, that sort of thing. We also have our research department, which is making sure we know what's going on, and we have a pulse on what are the things that are most immediately affecting Black girls and women. We have our policy and advocacy arm where the Black Women Vote Coalition sits. That's so important to keep women out of predatory lending places, and so we have our Walker Fund that does that, where there are need-based applicants where they can get cash from the organization that keeps them out of those predatory lending relationships. And then we have all the work that we're doing around reproductive justice and making sure that women feel like they have, and not only feel like, but have a tangible space of safety and solidarity in the Lighthouse. And so when we do this work that includes educating our electorate, we like to believe that we are doing that in a way that takes us from the ballot and then beyond it. So connecting the dots from what a woman needs in her home to how we can get those immediate services to her through our constructive programming, and then how we can then partner with those women who we're in community with to advocate for themselves to get the things that we need. And the way that we do that is through these legislative report cards, legislative reporting, and then not more importantly, but just as important, is through the Black Women Vote Coalition, where we seek to change narratives, to shift power, and build Black political power that is specific to the needs of Black women and girls. And we found that is most definitely an urgent need, is access to adequate health care and access to adequate health care in the postpartum stage. And so during the last legislative session, there was a bill on that came forth and actually had bipartisan support. We really did think that the bill would pass because of the support that it had. We were able to put together over 65 different organizations to stand in solidarity with us and to let our legislators know through various advocacy pushes, right? When that bill stalled out in the Medicaid committee, we did some huge advocacy work to get it onto the floor, where it eventually died as a result of Speaker Gunn not taking up any more bills because of the state income tax. We really felt like that was a disservice to not only the people of Mississippi, but specifically to women, more specifically to Black women, because we know that we are disproportionately affected when there is not adequate funding for Medicaid. So during this upcoming legislative session, what we're demanding happens is, number one, that they reintroduce legislation that would extend postpartum care from 3 months to a year. We feel like that is very minimum. We think that's the least that could be done, because we know because we've seen it be done without huge effect to our budget. We've seen it have bipartisan support. We feel like that's at minimum and very low-hanging fruit. We can get that in the 2023 legislative session. We hope that becomes then just a starting place of extending Medicaid coverage for Mississippians. The second thing that we're demanding that happens in the 2023 legislative session is a significant investment into the lives of women across Mississippi, specifically Black women who find themselves in rural areas not just the Delta, but areas like the Delta where they do not have within a reasonable distance from their home access to a physical healthcare provider. That's why we at the Black Women Vote Coalition not only are focusing on advocacy and making sure good legislation is passed, but then we're turning the corner and making sure that there's representation of Black women in political seats that write legislation, that are then voting on legislation, and then they can remember or know their lived experience and understand how important it is to think about women, children, and family, even when they are Black.